Can menopause affect a woman's fertility?
Hello and welcome. In this video, we're going to talk about a very important topic that affects many women around the world, menopause, and more specifically, how menopause affects a woman's fertility. This is a topic that can be confusing, but understanding how menopause impacts fertility is crucial for those interested in understanding their bodies better and planning their futures.
What is menopause?
Menopause is a natural biological process that marks the end of a woman's menstrual cycles. It's diagnosed after you've gone 12 months without a menstrual period. The transition into menopause often starts in a woman's 40s or 50s, but it can be earlier or later. The key takeaway here is that menopause marks the end of a woman's reproductive years.
How does menopause affect fertility?
To answer the main question, yes, menopause does affect a woman's fertility, and in fact, it marks the end of her fertility. Once a woman has fully transitioned into menopause, she can no longer become pregnant naturally. This is because her ovaries no longer release eggs for potential fertilization. Also, hormonal changes that come with menopause can also cause changes in the uterus and vagina that are not conducive to pregnancy.
What about the perimenopausal stage?
Perimenopause is the transition period leading up to menopause. During perimenopause, a woman's ovaries gradually produce less estrogen, and this phase can last for several years. Although fertility decreases during this time, it's still possible for a woman to become pregnant because the ovaries are still releasing eggs, albeit irregularly. To wrap things up, menopause is a significant stage in a woman's life that brings many changes, including the end of natural fertility. However, remember that there's a transition period before menopause called perimenopause where fertility decreases but pregnancy is still possible. We hope that this video has helped clarify how menopause impacts fertility and answered some of your questions. Remember, everyone's experience with menopause is unique. If you have any concerns about menopause or fertility, it's always a good idea to consult with a healthcare provider.